I was diagnosed in 2004 with a chronic inflammatory disease called sarcoidosis. It's a rare disease, which means that it affects less than 1% of the population in the US. So I was diagnosed when my son, Andrew, was just 3 months old. We had just moved back to Helena, so I had no doctor. And this disease can affect any organ in the body. So it started out in my lungs, and I was seeing local doctors in Montana. And then, a few months later, I was out on a walk with Andrew in the stroller, pushing him up a steep hill to the house, and I completely passed out on the street, lost consciousness for I don't know how long, woke up and was disoriented and just completely relieved that my son's stroller hadn't rolled back down the street away from me. That ordeal brought me to out-of-state specialists who tried different medications, which didn't seem to help. And it culminated in 2007 with the disease attacking my brain. It started off as a manifestation of meningitis. So I was hospitalized at St. Peter's, our local hospital, for a few weeks while doctors tried to figure out what was going on. Just incredible pain, uncontrollable vomiting from pain, disorientation. It was awful. I got passed around between hospitalists and different rheumatologists, and was sent home without a clear sense of what was going on, and spent the next 6 to 8 months literally bedridden. I was referred to see Dr. Weiner at the Cancer Treatment Center in late 2008 or 2009. And that changed my life. Again, not because Dr. Weiner had a magic pill to give me, but because finally I had someone who was extremely knowledgeable, who was extremely caring, and who was willing to take on what I think as a doctor would be a very difficult role, which is to manage care locally, taking direction from doctors who are unseen, who are the, super specialists. So I think it takes a doctor who's very comfortable in their own skin, who doesn't have a lot of pride, and who's willing to collaborate and willing, to work with others. Suddenly, in the middle of October, I learned that he had been terminated and walked off hospital property a week before I had an appointment with him. I went completely numb. I didn't believe it. I thought that there must be, some misunderstanding that surely this couldn't happen. Then I joined the Facebook group, the We Stand with Dr. Tom Weiner Facebook group that you and some other folks started, and realized that this really was happening. When they fired him, they didn't have a plan for a permanent replacement or replacements for him. I've had 5 treatments since Dr. Weiner left. I've had 5 different doctors, 5 different traveling oncologists since then. I feel like there's no one monitoring my care. There's no one taking a careful look every month and making sure that we're on the right track. The notion of who is there, who is monitoring the things that could affect my health, that could kill me. And I don't feel like there's anyone doing that. The other big area, I think, that I have felt incredible loss since Dr. Weiner left is just in that sense of security, in that sense of calmness that he brought. Reading all of the stories on the We Stand with Dr. Tom Weiner Facebook page, I realized he made everyone feel like that. He made everyone feel that they were the focus of his world in that time when you were in the room with him. No one ever felt rushed. No one ever felt like a question wouldn't be answered. No one ever felt, I think, that from what I've read, that their needs hadn't been addressed. And I think he carried that through with his staff. So there was this comfort and the security working with everyone from the people that checked you in for your appointment to the nurses who, accessed your port. And that's all gone. It's just so hard to describe. What I would tell Mr. Johnson is that he should try to walk a mile in a cancer patient or a person with a serious illness who is seeing Dr. Weiner's shoes. That he should listen to the thousands of people who are telling them that their lives and their standard of care have fallen, that their lives have been thrown into chaos, and that they are not getting the care that they need. I think he should look at the exodus of patients going to Bozeman, to Missoula, to Great Falls, to Seattle, to Arizona, wherever, because people don't feel safe with what he's created. Or a family member had cancer, or a loved one had cancer, or you had a serious disease and you were seeing Dr. Weiner. I don't think people quite understand how excellent the cancer treatment center was and how excellent the oncology department upstairs in the hospital were. I think we really had a national class facility. When community members have that terrible day, when they hear that they have cancer or their loved one has cancer, and now they're going to experience being handed among a group of traveling doctors who have no vested interest in the community. A lot of people, their inner patient advocate. And that I think a lot of us now, we're going to fight. Maybe it's not possible to get Dr. Weiner back, but we're going to fight to have the care that we deserve.
Yeah.